Welcome, everyone! Today we're going to dive into a topic that you will find extremely useful in your medical journey: primary skin lesions. Now, I know what you might be thinking. These names sound complicated, right? Macules, papules, nodules. It can feel like a lot to remember. But here's the good news. I'm going to make this simple, step by step. By the end of this lecture, you'll not only understand them, you'll also be able to confidently recognize and describe them in real clinical practice. So relax, pay attention, and let's walk through it together. You'll see just how easy this can be. All right, let's get started. First, let's remind ourselves of the layers of the skin. We have the epidermis, which is the outer layer. We have the dermis, which lies just beneath the epidermis. And finally, the hypodermis, which is the subcutaneous tissue layer. Primary skin lesions mostly appear on the epidermis, but some extend into the dermis or even into the hypodermis. Let's begin with flat lesions. Macule and patch. A macule is a flat, non-palpable spot on the skin, usually less than 1 centimeter in diameter. You can see it, but if you close your eyes and run your fingers over it, you would not feel a bump. Examples include freckles or areas of tinea versicolor. When the same type of lesion is larger than 1 centimeter, we call it a patch. Think of vitiligo, where there are both smaller macules and larger patches of discoloration. Now let's move to raised lesions, papule and plaque. A papule is a raised, palpable lesion, less than 1 centimeter in size. For example, a mole. If you run your finger over it, you will feel the bump. A plaque is basically a larger papule, raised, palpable, but greater than 1 centimeter. A classic example would be psoriasis, where large raised patches are clearly visible.
Next are the deeper solid lesions, nodule and tumor. A nodule is raised like a papule or plaque, but the difference is that it extends deeper into the skin, often into the dermis. It is usually around 1 centimeter in both diameter and depth. An example is a wart. A tumor in dermatology does not automatically mean cancer. It simply refers to a lesion that is larger than about 2 centimeters, extending deeper, often into subcutaneous tissue. A lipoma is a good example. Let's move to wheal. A wheal is a raised lesion with an irregular shape, often due to localized swelling or edema. These are the types of lesions you see in hives or allergic reactions. They may appear suddenly, are often itchy, and can change shape or location over time. Finally, fluid-filled lesions, vesicle, bulla, and pustule. A vesicle is a small, fluid-filled lesion, less than 1 centimeter. Think of the blisters from chickenpox. When that fluid-filled lesion is larger than 1 centimeter, we call it a bulla. A blister from a burn is a classic example. And when the fluid inside is not clear, but filled with pus, we have a pustule. Examples include acne or pustular psoriasis. To recap, flat, non-palpable lesions. Macule, less than 1 centimeter. Patch, greater than 1 centimeter. Raised palpable lesions. Papule, less than 1 centimeter. Plaque, greater than 1 centimeter. Deeper solid lesions. Nodule, about 1 centimeter deep. Tumor, larger than 2 centimeters. Irregular edematous lesions. Wheal. Fluid-filled lesions. Vesicle, less than 1 centimeter. Bulla, greater than 1 centimeter. Pustule, filled with pus. Once you get comfortable with these basic categories, you will find it much easier to recognize them in practice. And that confidence will make your clinical documentation clear and professional.